If you knew that the cost of healthcare was $3,000 there and $600 there, would you make a different decision? Find out the importance of data in this episode. Today's episode is all around data. Now, I want to talk about this word data and first talk about the level of importance. Why is this so important? Think about every other important thing that we do in our lives. Do we use data? You don't walk into a car dealership and buy a car without doing research. You don't go buy a house or get out a mortgage without doing research, without shopping it. The reality of it is the importance of data and the conversation around that it is absolutely crucial in making the buying decision around health benefits is huge. But the reality of it is our industry has made it seem like it is a black box and that you're not supposed to get it. So absolutely, theory number one around data is it's yours, you need to have it, and that if you think about it like every other expense, every other decision, every other important vertical in your life, you use data. Now, point number two around data. Let's think about why you need it and what to do with it. So when we think about the word data, we really need to go with what does it tell you? Right? And there's a couple of things that are really important about what data tells you. Number one, what data tells you is the where. Where are people spending money? Are they going to have their MRIs at local independent facilities? Are they going to that hospital versus that hospital? Where are people going to access their care? Two is the who. Are they spouses? Are they child? Are they whatever it might be? Your employees, their spouses, the dependents. You're going to want to know who is spending the money because now you can design your contribution strategy that way. Do you want to pay for 100% of the dependents? Do you want to have a spousal disincentive? Whatever it might be on a strategic standpoint, if you don't understand the who is spending the money and then the where they're spending that money, again, how do you make proper decisions? And the third piece that we talk about is really going to be the nitty-gritty, the types of services, the individual of the services that are being rendered. So we're going to talk about the what. What services is it? You can imagine if there is an opportunity to understand that you have an influx of MRIs, you have an influx of orthopedic surgeries, you have an influx of diabetics. Understanding what services people are having will allow you to draw a proactive strategy. More importantly, a proactive communication and education strategy. If we don't start teaching employees how to become better healthcare consumers, the reality of it is we're not fixing the future of healthcare. If I now know that if I go to that facility, it is higher quality, it is better cost, then I can now make a better purchasing decision next time. But if no one ever tells me, if I don't have the guidance around it, and if you don't have the data to be able to tell the story, the reality of it is we're gonna be stuck in the same rat race that we're in today. We're allowing somebody else, that fully insured carrier, to decide how much our premium is, and think about it. What does the insurance carrier call your premium? They call it revenue. Do you think that they want to lower their revenue? The only way we fight this beast, the only way we improve the quality of the benefits that people are accessing, the best way to develop a health benefit strategy that is going to allow you to recruit and retain the best employees centers around data.